lemon and a bit of ginger and cinnamon. And just grind them together. Yeah, something like that. I'm sure it's an energy drink kind of a thing. And if you grind it and have that juice, like just literally in a size of a shot, and you take it for continuously, 40 days or 2 months, your immunity levels really, really go up. They shoot up, and you feel the difference in the energy. Really. So small things like this, like you say, prayer and some things of that sort, a bit of exercise, meditation, it can really do wonders for all of us.
And this doesn't have to stop when COVID's over, right? This is what I tell people when you establish these habits. And generally, it takes about 90 days to establish a habit, right? I call it a season of change. In fact, one of my doctors asked me to write a book on it.
Yeah.
My psychiatrist, he loved it. He said, I love the way you put that together because I said, it takes a season to heal. If you break a bone, it really does take a whole season to heal your body and get back to where you need to be.
Yeah.
I've
I
broken
feel you should write too. It's actually a beautiful way to put it.
Yeah, but the thing is it's if you put it in your mind that it's not something that's going to happen overnight. I drank this
Yeah.
drink and I'll feel better tomorrow. No, that's not how that works.
Yeah. Yeah.
You have to, like you said, do it routinely every day.
Yeah.
Build
Yeah.
these little habits. I found when I started praying more on a different level, not just because of what I used to do, but a different level, I'm more focused on my time
Absolutely.
and I prioritize in my brain a little bit more what's important, right? And I think these are very important. But praying is yoga. By the way, we got a yoga show every Sunday.
Yeah.
Yeah,
Brilliant.
Doctor You decided. You know what? I need to lose the COVID-19. So he's doing COVID-19 challenge. The 19 pounds we put on while we were sitting around at home, right? So
Well, tell me about it.
So, right? So, and I love that attitude because yoga, will really give you a workout. I had no idea. So
Yeah.
I did it with him. He's in California. I'm in North Carolina, but he got on at 2 p.m. Eastern Standard Time, which is 3 hours earlier in his time.
Yeah.
And but
Wow.
it's a show you can watch anytime, right? He made it very evergreen. This is how you
Would
It's
love
more
to.
about the yoga from a doctor, and that's a hot yoga. So he do out at the sun.
Oh,
Yeah,
so we have
yeah. So we
ample
do it in
sun
the
these
sun.
days in
So I
India, so I'm sure we can try.
Yeah, the sun's out in India, right? So, but not probably during the time we do it here. But you can do it anytime. We film it, and then air it again. But it was kind of fun because I went outside in the sun too, and you do sweat and or glow as women call it. But
Yeah.
wow, right? Just energizing. But what I liked about what he was doing was hydration through the whole thing.
Yeah.
That and he told he said drink your water, take time, breathe, drink your water. Just good, but he's a doctor giving the yoga, and that was important to
we
me.
have Dr. Saggu as well.
Hi, Dr. Sagu. Welcome.
Hi, how are you? Thank you so much. Namaste, Sashikal.
Namaste. Have you been working today?
Yeah, we have started working now. We started our surgeries also, and now I'm in more busy with the patients.
Yeah. So, I mean,
Yeah,
today we've been talking about just keeping our attitude and just everything positive, trying to find joy in our lives so that we're seeing the light at the end of the tunnel as opposed to feeling like we're still trapped, right? I think this is what, and as a life coach, you could probably understand this. Oops, she disappeared. Um, but I think, and as a doctor, sometimes we feel trapped, right? And we don't feel like we're recovering because we lost our routine. And this is where a lot of people are, and now there's so much uncertainty about going out into the world. So, Dr. Sadu, in your facility, are there some common practices that you're trying to teach the people and that the doctors are talking about? Your camera looks really good today, by the way. It's very
thank you
Yeah,
clear.
so
the
much.
background is beautiful.
Yes, yes, it's very beautiful back there. But are there some common changes in common practices, or some things that you're recommending that people still do or don't do? There's big complaints. Nobody wants to wear masks because they feel like their oxygen's being deprived. Is there a better way we can wear masks? Just those kind of things. There's a lot of questions that keep popping up.
Hello. Yes. Yes, Kim. And it is very important. I was just listening to your tips by Dr. Shruti. Whatever she said, I think the combination of all the component is very important in this crisis time. There may be the combination of any type of your activity, whether it is a physical activity in form of yogas, whether it is a mental activity like you're meditating, you're doing yoga, you're doing positive prayers. So all these things, what they are going to give you the positivity and your better immune system, better defense system. If you have a defense army within you with the strength, I think you can fight with the COVID-19 in the better way. So we cannot control the COVID-19, but yes, we can control ourselves. We can build up our immunity. We can build our defense system so that we can fight with this COVID-19. And I don't think there is any type of problem. Sorry, just hold on. I'm audible?
Yeah, very audible. Very nice.
Okay, just hold on. I think
I would suggest one thing to all the viewers, and especially to the experts who would log into from the mobile phone. Before logging in, if they click on Do Not Disturb, they won't find any messages and calls, and they can concentrate on the video. Okay. Yeah, that's a tip. That's a tip.
Just a tip, yeah. And kids got good tips for this. So
it's just that you just have to select Do Not Disturb, and then you won't find any pop-ups and drop-ups and calls. I mean,
yeah, I'm getting a lot of calls from the patients. That is why they are disturbing me. So let me quickly disconnect and reconnect it.
I do.
Let me disconnect
problem on my phone.
Okay.
I have the same problem on my phone. Here's something else that I found that
whenever you want to use your phone for calls.
Yeah. That will be helpful.
It's a telescope, right? Mm-hmm. But what I like about this one, you'll appreciate this, is well, if you have a big bag, but for the most part, it will fit in my purse, right? Or I can clip it to the outside. I travel a lot, so this is as big as my purse will go because I don't want anything too heavy. But it's really good because I like it because any device will kind of fit. The phone will fit in it really well. But I like it because it's a telescope. So if I have a desktop, right, I can put it on my desk. But it goes up to 4 feet.
I know.
And I think I paid.
That's it.
Same.
Handheld too, right? So you can.
This is the very good device, and the same device I do have because I need to record lot of videos for my patients' testimonials and some corporate videos also being shooted by this device. It's a very good device. So we were talking about the common practices which we are doing right now. So all these type of the tips by Dr. Shruti, they were well taken. And now because we have already experienced the lockdown of around 2 months, and a bit of that COVID has been controlled by that lockdown, I cannot say that the lockdown is used to prevent the spread. We cannot prevent the spread by the lockdown, but yes, we can buy some time to do other things by procuring your beds, procuring your ventilators, procuring your test kits, and procuring your other things and building up your immunity, and let the environment be in favor of us to boost of our immunity also. So the God has also done a good job for us. They have cleaned the air, the Yamuna and Ganga, all the lakes in India, they are now clean. Everything is clean. So now what are the practices? We have saved the lives, and this is time to save the livelihood. If we can lift up the lockdown, we can open up some economy, we can do some work, we can look after our patients also, we can look after our patients so that they should not be developing complication because of that disease. I think that is good. So in this time, the same formula is there. We need to follow all the things. A good hand washing is very important. Mask is very important, right? You have to have a good etiquette, cough etiquette. You have to cover your sneeze and cover your elbow. That is very important. prevent yourself and prevent others also. That is also very important. All these the measures has to be followed very nicely, and along with that, you are going to build up your economy. You are going to serve your country, you serve your nation, you serve your world, so that the economy can be lifted up also. So now everything has to be done in a good manner.
No, and I agree with you. And like you said, you
Yeah.
could not have said it better. Now that we've kind of saved our lives, it's time to save our livelihood. But
Yeah.
do it smart, right? Just don't go out there and forget the practices we put in place. I truly believe that the lockdown was more about, like you were saying, isolating the situation so that we can get it
Yes.
under control, treat the people that have the severe cases, and learn, right? Learn about how we and understand it. There are still people who don't really understand what the COVID is. I don't think the researchers know everything about it. It's just we're still learning.
Yeah.
And
So
every day there's a new fact that is coming up. If you watch news also or something, it's like whenever you start feeling okay, fine, something is, maybe getting worked out, but still there's another fact by some part of the globe or country. So it is, I think, a work in progress. But as long as we can hold this thought in our mind that there will be a solution, we are getting close to it, or maybe we need to get used to this transition and start learning to live with such changes, because this year it's COVID, maybe next year that's some another challenge, not a disease but something else. So it
Yeah.
has to,
so
keep moving.
that
It
is,
has to be,
yeah, yeah. That is
on
why
the go.
that came Dr. Shruti and Ankit. So it is very important not to look forward for the vaccine. What is the vaccine? Vaccine is a acquired immunity,
Yeah.
right?
Yeah.
And whatever you have, that is a natural immunity. I can understand that natural immunity cannot be a specific, and your immunity by your vaccine would be specific to that COVID. But somehow we know as a Indians, we don't have that much of severe complication of COVID-19 because we do have immunity against tuberculosis, we do have immunity against the measles, we do have immunity against the smallpox. So because of that non-specific immunity, if some part of that immunity is working for this COVID-19 as well, why not your natural immunity will work for COVID-19? Why do we wait for the vaccine to be developed, and only up to the time when this vaccine is going to develop, we would be under lockdown? I mean, this would be foolish to wait for the vaccine. Let's develop our own immunity. Let's be strong, be positive. That is very important.
Yeah, it
Definitely.
is. It is positive approach is the way we're going to get out of this situation. So many people are not positive right now, and the thing
Yeah,
to do is just. A doctor one time told me, just start doing something, and you'd
yeah,
be surprised how much better you'll feel if you're moving forward. But if you sit there and wait and wait
yeah,
and wait, you're not going to feel better. You're going to get depressed. You're not going to
yeah,
sleep well because you're constantly. But if you just move, take baby steps, if you have to, right?
yeah,
Just step, step. Try different medication, not medication, supplements, right? See how they react in your body, if they make you feel better or not. But if you're just sitting there and not doing anything, you're just going to feel worse. So positive movements, people. Um, and if you don't know, ask a doctor.
yeah,
There's
yeah,
many of them
yeah.
that will take phone calls right now. What did we say through the whole series? Stay at home, use your phone, call the doctor.
Yes, yes.
You know, um,
If we talk about the mental health, right? So if we are focusing on one thing, sitting at home, and yes, we can do meditation, we can do yoga, we can do a number of the mental exercises. But the best exercise is when you divert your mind to your profession. That is the best exercise. So when you start your that type of the mental activity, that type of the mental exercise, I think the 50% of the fear of this COVID-19 will go. So why we are getting a lot more patients of the mental sickness right now? We don't have a physical sickness. We don't see much of patients because of the physical sickness. We are
Yeah.
looking after a lot of patients with the mental sickness. So that is because they are away from their work point. They are being scary of their future. They are being scary they are worried about the future of their kids, their children, and they are worried for their social security, they are worried for their financial security. So when we can fulfill all these securities, when we can provide positivity to the patients and all the people, they can go for their profession and they can divert their mind. I think that more than 50% of the battle we can win only by diverting their mind towards their profession.
No, and that's
Madhukar,
the
I would
whole
like to
thing.
add one point. Do you think patients should accept whatever the problem they have, and then they can start preventing out of it? Because I think a lot of people are not accepting the issues or disease they have. They think that they can bypass and they can eat a lot of things and things like that. I mean,
Yes, yes, yes. I mean, Ankit, there are a lot of things. I mean, you start ignoring some things also. You start ignoring your disease also. You are not controlling well there in the initial period. Now you don't want to go to the hospitals. You are not giving good care to your disease. You are not taking regular medications also, right? And when there is a lot of stress, and in the stress you start binging your diet. You can start the diet binging. So that
yeah.
will again that will again, you're going to invite the bigger pandemic, that is an obesity. So we need to think all these things. Yeah.
Thank you.
So,
Thank
so
you for saying that. Absolutely. There are bigger pandemics and other things to worry about as well. And not that we want to worry the world about all of these things at one time, but if you're taking control of the situation now and doing some of the few things that we've been talking about, you avoid all the other pandemics. Like, when Dr. You said, you know what? Because I guess last week we were talking about all of these things. And you know what, Dr.
yeah,
Saggu, I want to tell you something. You know how you guys last week we were talking about chew your food more?
yeah, yeah,
I started
yeah,
doing that. And I
yeah.
actually
That is, yeah,
I started
eating
putting
etiquette.
on music.
Yeah, yeah.
So
That
when
is very important.
yeah, but here's what happened. So I started turning on music. I normally don't, I never watch TV while I eat, ever, ever. I prefer conversation, but put background music on, right? So I had the music and I started chewing. I was conscious.
Yeah,
Uh-oh,
yeah,
I froze. But here's what happened. The food tasted better. I enjoyed it.
yeah. That's good. That's good. It's true. It's true. It happens.
And but maybe I will eat less. I don't eat a lot anyway. People fuss at me because I don't eat a lot, but I still put on weight. But I started thinking maybe I kind of put on weight even though I exercise and do all these things. Maybe I'm not chewing the food right, like we were talking, right? I'm not drinking water at the right time of day. I was so I'm changing the way I do things. I feel better.
Yeah.
And but chewing that food, it was just
So yeah,
enjoyable.
it's not bad to make your food your friend.
Yeah,
Talk to your friend.
exactly.
Talk to your friend. Your food is your friend. Talk to your friend. And how can you talk to your friend? Only by chewing. Chew
Chewing.
your food. Yeah, chewing your food is always talking to your friend.
But
Fully you are concentrating on your friend, on your food. So that is the best practices
yeah,
while eating. That is the best eating etiquettes.
and the flavors, enjoy each flavor. Now, Sundays,
Yeah.
I never had a problem doing that on Sunday morning for whatever reason. I butter each bite of the biscuit. It's just slow eat, but why wasn't I doing this every day? So, yeah, I've taken what we talked about last week and I've put it to practice because I felt it important. I meant to ask Rakesh before he left if he turned off the TV while he ate because he was like, I'm turning that TV off. Because too many people they do that. They try to cram in too much stuff at one time, and so TV can be really bad. Tune out the advertisements. Way too much junk food being advertised, and all the bad things for us. So, what else do you have that you'd like to share with us about our healthy habits?
Yes, and the eating etiquettes we already discussed about the how to eat, when to eat, what to eat, and what not to eat. So if we know all these things and when to drink and how much to drink, if we know all these things, I think more than 50% battle we are going to win against the obesity as well,
Yeah,
right? We discussed about the timings also. You have to be very much disciplined for your eating, your the timings of the eating. You have to be very much disciplined for your sleeping as well. You have to be very much disciplined about your physical activities. You have to modify your lifestyle also, because stretching of your muscle always they releases some hormones, so that take away your stress,
Right.
that take away your hunger, right? So doing some exercise is very important. You can start with the low intensity exercises, then slowly and slowly you can go with the strengthening exercises, or the weight bearing exercises. So combination of these all type of the things, your diet habits, your lifestyle modification, and your awareness regarding your food, regarding your health, regarding your physical health, and regarding your mental health, that is very important.
No, it is. I mean, these are all the things that we should be conscious of that we tend to forget. They sound like common sense, but they're not, I guess, because we get in a hurry and we forget to apply just the basic things. Another thing we were talking about today is wearing the mask. So many people don't want to wear the mask. They're not conscious about other people. They're more concerned about themselves. And one of the things we talked about is scenting the mask so that it smells better, right? A lot of people are like, I can't breathe in it. I think there's a proper way, and a lot of people just are not wearing it properly. Am I right? You
Yeah,
know?
yeah. So for the normal people, I think the cloth mask would be better. So they can wear the cloth mask, because the mask that can absorb the things. This surgical mask will not absorb the things. So it is a repellent, flu repellent. So I think the flu repellent, the normal people they cannot tolerate. They feel suffocating, so they can wear the normal cloth mask. That is very important. But covering your face, covering your mouth, covering your nose, your eyes is very important. now
Yes.
you have to now you have to build your culture. That is very important. So these preventive measures, they has to be integral part of your culture. Now you have to change the way you were living, and you have to change the way you will live after you can say in the post COVID era. So if we can make all these things a part of our culture, I don't think there would be much problem. So
Mhm.
lockdown would not be a solution for this. Your culture would be solution for this. You have to change your habits. You have to keep cleanness around you. You have to have a hygiene. You have to have your mask hygiene, your hand hygiene, your cough hygiene, your sneeze hygiene. So that has to be the integral part of your culture.
And we've taught to do this when we cough or sneeze.
Yeah.
And again, this is what I tell people: it's not going to prevent it 100% from spreading, but it does
Yeah.
contain it. It does
At
do.
least, at least, at least you can cover your cough, your sneeze with your elbow, right?
Right.
So that you can wash. You should wash this also. It's not there that you cover your sneeze and cough with your elbow, and you will not wash your elbow. That is very important.
That's right.
Yes.
You can take one of these and
Yeah. Yeah.
just wipe it off real good.
Just wipe it off.
And yeah, I mean, yes, it's going to take starting to carry the little sanitary wipes or maybe the little hand sanitizers that you
Yeah.
could use to this. Be careful. Make sure your clothing can
So,
handle
so
the
that is why you need to wear this half sleeve shirts.
material.
Don't wear the full sleeve shirt, so that
Okay.
you can wipe off with the sanitizer. So
There you go.
wipe it with the sanitizer. Yeah. If you have a cloth over there, I don't think you can wipe it with the sanitizer. That you have to wash, but you will wash in the evening when you will go home. So that is why
Exactly.
you have to wear the half sleeve shirts, and clean or wash your hands till your elbow. That is very important. This is the area you have to wash till elbow.
Well, that's very smart too. I'm not one. I don't like to wear a lot of short sleeve clothes, but I'll figure it out. I'll figure it out. Like Nick, he'll carry probably Lysol spray and spray everything.
Because
And a
the
Lysol.
COVID has made us more casual now. So now in the doctors also, they are wearing very casually. Even I start wearing my scrubs from the home. So now I go to my hospital in the scrubs. So then we can change the scrubs in the hospital also. Again, we can wear the number two scrubs, but from house we are going with the scrubs, so that if there is any, the spoiling of your hands, you can wash it properly, you can sanitize it properly. And one thing which we ignore, I think we should start, if we are not doing, sanitizing the car also. In the car where you're going, you have to sanitize it daily. That is very important.
So
That we are doing on regular basis.
I'll wear my mask into the store, right?
Yeah.
But then when I get to my car, if I take my mask off and it had a contamination, I could breathe that in, and then it's on my car. So people were joking about people driving with their mask on, and I started thinking that's not funny. That's serious.
No, you can remove. If you are single traveler, say no to your driver. I don't think you need a driver now. You sit in the car and you travel, please, only one person. If one person is traveling, I don't think in the car there is any need of mask. You can remove your mask, you can keep in the car, right? And you can put on your AC also. But if you're two persons in the car, you have to wear the mask also, and you cannot turn on your AC. You have to go with the AC off. So I think one person should travel in the car, and the car has to be sanitized daily. That is very important. You have to treat your car as your office. While in the office, we are cleaning our table, we are cleaning our sofas and chairs and floor and the handles and the doors, everything. So in the same manner, you have to sanitize your car daily.
So you know what we're going to have to go to? We're going to have to go to autonomous driving cars.
Inside the sun, right now it's 44 degrees Celsius in Delhi, and if you put the car right inside right at the sun, so can it be automatically?
No. Sanitize. The virus don't have any effect of the temperature. Please. Okay. The temperature will not going to kill your virus. This is your sanitizer. You take 1% of sodium hypochlorite in the spray, pump it properly in your car daily. Sanitize it with the help of 1% sodium hypochlorite. That is very important. Sun is not going to sterilize your car.
I'm not using my car daily. I use it just twice a week. So
no, you can do, if you are frequent travelers. If somebody is also sitting in your car, or you are carrying something in your car, I think on the daily basis you should spray it. You can spray while reaching at your office, because you would be there in your office for 3-4 hours. So you before going to your office, you can spray the car, and when you will come after 3-4 hours, it will be okay.
Okay.
So I've been working with other physicians and people who need PPE equipment. I'm trying to make people connect resources, because our president doesn't seem to know how to do this. So when somebody says they need, they ran out of PPE, and I know somebody who might have it. But so I'm going to share with you something, because you're talking about, we're going to have to do better eye protection. I just want to get your opinion on, let's see if this shares right. Can you see this?
Yeah.
Can you see this? So is this the proper maybe kind of goggles we can go to, for especially for people like me who might need to wear glasses sometimes? I know that there's all kinds of eye protection in the medical field, but I mean, do you think that, because these aren't that expensive, they're expensive, but they're not that expensive, but there's the shield, right? And I see a lot of people wearing that, and I think it's very important to wear the hair.
We are wearing this shield because this shield is protecting your eyes, protecting the leakage from your mask, everything, and it will come down. It is beyond your chin. So I don't wear the goggles in even the OR also, during my surgery also. I usually wear my screen. I think I would like to show you my pictures here.
Okay.
I don't know if I can share here my pictures wearing this.
All right, let me stop sharing so that you can share. Hold on. I'm going to stop sharing so you can share. But I just kind of wanted to get a feel for what your opinions were, because people are wearing the big shields now with hair cover. People were asking yesterday, how do we ever get back on an airplane again? I mean, and I have to agree. I don't want to be sitting on an airplane crammed in anymore. So, there are all kinds of questions, but if you've got some pictures that you could share with us, these are things that we can consider when we go out into public that might look fashionable one day, right? We're going to make it fashionable. Hey,
Yeah.
they had pink goggles, right? They had green and pink. You can get a couple of colors. I thought that was cool. And you can get matching masks. Oh, I just like to joke.
This is a respirator. I think this is a respirator. I don't think you need all these type of the mask, even for medical field.
I'm going to get that little compressor that Doctor had.
What we were doing surgery? We are using this N95, right? Or then we are putting a normal surgical mask. Or this N95 is also comfortable. So this is also comfortable mask.
I like that.
So these two masks they are the good enough to wear on. But during surgeries, what we are doing, we are wearing one extra mask also on that. So I think Ankit can share my pictures in that. Do you have my pictures, Ankit?
If you can do the share screen, then only I can share it. I mean, there's an option called share screen right at the bottom. If you can click and share it, then I can put it live.
I don't think I have.
Are you using a laptop or mobile phone?
No, it's a mobile.
So mobile.
Yeah, I don't think in mobile I have any option to share my screen.
So maybe mobile they don't have an option because it's limited.
Yeah, mobile don't have. I'll send it to you and then you can share it.
Sure.
With Ankit, and he can share it with us. I think this is an important conversation.
Yeah.
I think this is important because so many people still don't know the proper way, the proper items, why certain things are important versus others. People are not, eventually I think we're going to go back to wearing gloves again. That will become a fashion statement, like Audrey Hepburn wore in Roman Holiday, right? She was always wearing the gloves. So I think that we need some fashion trends to help us find better clothing that we can wear. Again, I think they're going to have to be washable.
No, I think the normal people, we should not be wearing those gloves.
Okay.
They would be more effective. Rather, we should be going without gloves, put your stuff, and sanitize your hands.
There you go. That's right. The way we've been practiced. It's funny when I went to my doctor's office, they were impressed because I knew how to.
Yes.
They were like, where did you learn to do that? Nobody that come, and I did. I knew I was doing all of this, and
so start from here, then this, then this, then on back this,
the back,
then on back this, then your thumbs,
then
your thumb, then your palm, then your wrist, So
and
this is
I
the
was
full
going
on.
through the motion, and they were like, wow, where did you learn this? And I go, we learned this in the very beginning, of COVID. This is the first talks we had on our show. So,
I'll share my video also. We have a video of hand washing.
Good.
So,
we need that.
I can share.
Hand washing.
I'll send it to Ankit, and Ankit can share that.
Awesome.
Yeah, because if the normal people, they are going to wear the gloves, then they will forget to wash the hands. And if you forget to wash the hand, that would be more infective. So that is why no gloves, they would be more infective, because you're not sanitizing your hands and you're touching your face with the gloves. And those gloves, they are infective. Even you are touching your mask also, and you make your mask infective. So better is to keep your hands like this, but properly wash it or sanitize it. That is very important.
So I know a lot of people don't know how to do gloves. I trained when my mother was sick. They taught me how to do gloves. Like, we would layer our gloves, right? And then every time we did something, we would just peel the glove off, dispose, right? Do something else, peel the gloves off. and but we learned to not go to, but I was trained to do that. But it is, you lose those habits, and it's easy to go to your face. So I think, yeah, you're right, it's better just to get in the habit of washing your hands or
Yeah.
sanitizing all day long. And Alexandra, welcome. How are you doing?
Yay! I'm good. How are you guys?
Hi, Alexander.
Oh, you know,
I'm good.
Hi.
it's interesting because every day sometimes feels like the same, but I
Sure.
always get excited about the weekend because I know we got fun lineup coming, right? It's kind of like it's redefined our week and weekends, right?
It
So
has.
Oh,
you can
check
say this
it
is,
out. Do you have
yeah,
one of these? Do you have one of
yeah.
these, Alexandra?
We actually in my dad's company we actually sell them. So yeah, we also have ones that like once they're on they flip up, which is kind of like convenient. So
I like
yeah,
that.
we do have those.
So
Look like
Alexandra,
a hat bill.
Yeah.
Because
I need 5 for my family. Can you ship it?
As soon as we can ship, hey? As soon as we
Yeah.
can,
Very
we'll
soon.
start shipping.
But
because
no,
now this
What a
this
coincidence. I mean, we are in the gray, and then I mean, Dr. Saggu and Alexander the black.
okay.
yeah, it's
So
definitely
this is
chill.
this has become very useful for me. This has
Yeah.
become the integral part of mine. So everywhere,
So,
whether I'm sitting in the outdoor OPD, I'm looking at my patient sitting in the clinic also. Then also I'm wearing this. Doing the surgery also,
Yeah.
I'm also wearing this. So this is very protective. I mean, the goggles you cannot tolerate sometimes because my surgery is for 1 hour, 2 hours. So all the time I cannot wear the goggles inside. So it is better to put this, and then they wear clothes also all over. Then my PPE is all over. So this is very comfortable for me.
So
so
can I ask a
we
question?
regular post surgery and post OPD, or I mean, you have multiple of them to use it.
He wears that too.
Sorry?
Okay.
I'm talking
No,
about the
no,
shield.
multiple. Yeah.
Okay.
What's
Shield
the
actually,
question? Okay.
the one shield is only for 1 day. So then
Okay.
the next day we wear another shield, and this
Okay.
shield can also be sanitized. So every hour they are going to sanitize this shield also.
Okay.
So it is
Right.
useful.
I
What's the
actually have a
question?
question because a lot of because we obviously sell that product, and then we also sell the reusable face masks, and so you can wash them and they're all sanitized. But I've seen a lot of people walking around in the shopping malls just wearing the shield and not the actual mask. Is that I mean, I don't know. Is that like is it not a good thing? Because I'm guessing if somebody sneezes, it can still get in and
Yeah.
around, and you still want to protect. Am I right?
So I don't think we need a shield for the normal people in the mall.
Yeah.
Right.
The mask is more than sufficient, and
Sure.
everybody is, I think, having frames. So you can wear the normal frame also. Zero number you can wear so that you can protect your eyes. And the
Right.
mask is
Yeah.
very important. What is the what should be the integral part of your life is your hand washing, your hand
Yes.
hygiene, your mask. That is
Mm.
very important, and your cough and your sneeze etiquette.
Yeah. Yeah. I think that's very important. Thank you.
Yeah, yeah.
No, I think so too. I think, we need to, make some common sense practices. And, it'd be nice to have a shield like that we could wear if we need it going somewhere. I like it. I like the way it's shaped.
Mm.
Alexander, you said they got them that pop up.
Yeah, yeah. So because we're an essential service, because we supply sort of cleaning products, chemicals, hand sand. We've been doing it for 2021 this year. My dad's company is 2021. So we've been doing this for 20 odd years, and we sell them to gas stations or fuel stations. So guys that are working literally on the front line, and they have like the branding across. So they've got the fuel station name across, and they pop up when they need to take their mask off, whatever, and it's all right here. So they're not touching, they're not like going underneath and they're fiddling. They're literally just flipping it when they need to, and they're flipping it down, which also is important. And we're obviously, I've come across a lot of people because I help out in the business every now and then. And I've come across a lot of people who are making their homemade hand sanitizer, but not like good sanitizer. It's like just pure bleach on their hands, and it's some random alcohol stuff. And it's just, I hear this and I think, you're going to like destroy your skin. You know, you're gonna kill your skin. You really have to go to the bathroom, take a bar of soap, wash your hands, use hand sanitizer on the go, but then go back in, wash your hands every hour, whatever they suggest. So it's just surprising how much misinformation is out there.
So
No,
better is to trust your soap and water. That is the best sanitizer,
Yeah.
because that
and
you can
water.
use, and that will not dehydrate your skin also.
Yes.
All type of sanitizer, because every sanitizer is alcohol based. So whatever is
Yes.
alcohol based, they are going to dry your skin also. So that can damage your skin also. I think soap and
Yeah.
water is the best method to clean your hands.
Yeah. Agreed.
Yeah. Thank you.
And Dr. Saggu, also, whenever we use a sanitizer, we have to stay away from fire for maybe for an initial couple of minutes, because
Yes. 4 to 3 minutes. 4 to 3 minutes. Yeah, because alcohol is inflammable, so there can be inflammation or something.
Yeah.
So you should be away from all these things, and you should also dry it properly. It should be dried properly.
Yes.
So the sanitizer is only for the things when you are sitting in the car. You just sit there and.
Yeah.
So I think it's time to go now, because Dr. Tula is there, the more experienced person. You're welcome, Dr. Tula.
You're most
Namaste.
welcome. You're most welcome to be with us, sir. It's not that I come, you go, sir.
Seeing you again. I miss seeing you guys when you don't show up. So I'm so happy that you're still coming and watching and being a part of our show and sharing the wisdom that we need to move forward, common sense wisdom. But when it comes from a doctor, people believe you and take that in better stride. And like you said, we don't need those chemicals. We can just use soap and water, and just be common sense. Don't panic.
Yeah.
Oh, good evening. I'm watching you live from Ghana. Well, hello, Eric. Hey. So isn't this great? I mean, we get calls from people all the time, or messages from people all the time, from UK, from everywhere. It's awesome that we have grown this way. But Alex, I want to share something with you real quick. I think the questions are going to need.
Sorry, Kim. I'll take your leave now.
Okay, thank you, Dr.
So tomorrow I think we have a show at 8 o'clock Indian time.
Oh, that's right.
So we would be. We would. Sorry, 8:30. Okay.
10:30 with Dr. Saggu tomorrow. We look forward to it. Thank you, Dr. Saggu. 10:30 tomorrow.
We would be talking about how the obesity has ruined all ages, from womb to tomb, from the uterus, inside the uterus, from the tomb. So womb to tomb, obesity has, ruined the life. How we can protect ourselves, how we can be free of the obesity. Thank you so much.
I appreciate it. Thank you so much, and we look forward to seeing you tomorrow at 10 o'clock. Take